Hi, everyone. Charlie Piermarini here with Stephanie, and this is our first podcast of the MedCanna today. We are both physician assistants, physician associates, and we've created this platform in order to really build a legitimacy around medical cannabis, the use, the research, the policy, the community, all encompassing and putting it into one place through podcasts, through YouTube, through blogs, and through articles. Our goal through this podcast is to really educate you, the consumer, about what medical cannabis is, and most importantly, about what it isn't, and how proper usage can really benefit certain conditions, and how overusage of certain, cultivars or certain strains can really give you, bad side effects, like a lot of people have experienced. But our goal here is to break down the most current research, the most current bench research, all the way to the most current medical trials that are going on, and some of the most common policies that are going through Congress, and really trying to help you and the whole community figure out where this whole community is going, and where the whole, cannabis situation is going, because it's in flux, right? Is it going to become a scheduled drug? Is it going to stay a Schedule One and kind of have this that it's okay by the states but not okay by the federal level? So our goal here is to help educate ourselves and educate you along the way. And we're both coming from different viewpoints of being medical professionals, and so we just want to add value to the community. And I'm joined here by my partner Stephanie. So Stephanie, why don't we talk a little bit about like what brought you into cannabis? As a quote unquote Western medicine PA, we're trained in the medical model, and they don't give us any lectures about cannabis or CBD or any of these things. And so, what really drew you into this field?
Hi, Charlie. Thank you.
Yeah.
Thank you for explaining to everybody what our mission is. I'm really happy to have crossed paths with you, and I'm really happy that we share this passion about educating the community, educating other providers, particularly PAs. Like I had mentioned to you, I went to a cannabis science conference in Baltimore maybe about 2-3 years ago. And I realized that there was no PAs. And if there was any, I didn't know of any. It was mainly physicians, pharmacists, nurses. They're taking over, and it's a good thing. But at that moment, I realized that PAs also need to be involved. And so that's my mission right now, along with educating the patients. So what got me into this was really my patients. They kept asking me, hey, can I use CBD? Hey, should I get my medical marijuana card? And I was like, I don't know. I didn't know what to say, because, they always train us to say it's not FDA approved. There's very limited studies, and so therefore we don't necessarily recommend it. I do women's health, and most of the women that were asking me were patients who had dysmenorrhea, which are painful periods, or endometriosis, or dyspareunia, which is pain with sexual intercourse. So once I had a good amount of patients ask me about it, I started to look at events, mainly medical events. And yeah, that's how I started. I started networking. I started meeting people. I started getting provider tours at the local dispensaries. I was practicing in Virginia at the time. And Maryland already has a medicinal program, and Washington, D.C. has a recreational program.
Okay.
Well, they want to call it adult use now.
Right.
So we should use the proper terms.
No, yeah, and I think that's important, how most providers come into this field. Either they're connoisseurs themselves, or a lot of times it's the patients that are bringing us into this field, because we get very little training about the endocannabinoid system, or about CBD, or about cannabis, how to properly dose it. And so patients bring us into this because we are typically the ones behind the computer with the knowledge that are able to kind of guide the treatment path and kind of guide where the conversation is going. But then when they ask us about this simple plant that's not so simple, that's been on the earth, long before us, and we know nothing about it, sometimes it just kind of leaves us hanging. But yeah, that's our mission. And you are the president and the founder of the National Association of PAs in Cannabis. I'm the vice president, and so our goal is to really further PAs into this field and really help blaze a path for all of our fellow colleagues to feel comfortable, right? Because even when I started my CBD company, I was so scared. Am I going to get sued? Am I going to lose my license? Right? And just you don't know where to turn. There's no resources, and so that's what we're trying to accomplish with that organization, and also with the MedCanna today. Just giving information, because you short from either buying really extensive textbooks on cannabis pharmacy or going to PubMed. You really, there's a few courses out there, but it's really hard to find really succinct educational podcasts that can really get you down into the science of what's a CB1 receptor and how do you dose cannabis and CBD and what's the proper usage of it. And so I think that's great that you've really, you're trying to grow into this field, and you've brought me, into the National Association of PAs in Cannabis. And I think together we're really going to try and kind of stir it up. And so that's going to be a fun process. So in your day to day, as a PA, how do you see cannabis kind of fit in with your patients now that you've kind of educated yourself the last couple of years and you're going to these conferences and reading? Like, what do you see cannabis kind of now and in the future? How do you see it kind of fitting in medicine?
Oh, I see it fitting in all specialties, not just women's health, but pain management, cardiovascular, because it's anti-inflammatory. There's certain studies that do show it could be neuroprotective, cardioprotective. So I can speak more for women's health because that's what I practice. When certain laws change, and there are some states that I could give the recommendation for CBD freely, and Virginia is one of them. And I just ask my patients now, hey, have you heard of CBD? Are you interested in CBD? Would you want to learn more? There's patients that are very hesitant about it, and it's fine. We'll discuss all the other options: birth control pills, NSAIDs, heating pad, exercise, lifestyle changes, right? Because cannabis isn't a miracle treatment. No. Or I guess we shouldn't even call it a treatment. We can't call it a treatment, but it's not a miracle drug, I shall say. Right. But it definitely helps. And the patients that have used it, they've come back and told me, my periods are so much better this month, or I actually was able to have an intimate moment with my husband for my birthday or for the holidays, and it had been years since they were actually intimate. And so those stories is what drives me and what keeps me wanting to move forward and continue with all of this process. Right. Yeah. And so I know we both run into one of the hardest aspects of this whole field is the lack of kind of standardized approach. And so like, how do you, what's your discussion with some of these patients when you talk to them about, hey, cannabis is I'm going to recommend it for you, but where's that conversation going? You're like, hey, you want to use this for your dyspareunia, but how do we start? Where do you initiate them usually? And how do you find that process with them? So unfortunately, because where we're at, I still use it as an alternative treatment. I would hope that in the future it as a first line treatment, as it was used many, many years ago in Eastern medicine. But I do use it as an alternative method once I've exhausted all my other options, like I mentioned before: birth control pills, NSAIDs, lifestyle changes, exercise. Then, at that point, I'll ask, hey, would you be interested in learning more about CBD or cannabis products? Because I think it can help. And then I'll go into discussing the mechanism of action and things like that. That's great. And it's kind of sad that, back at the turn of the century, the 1900s, cannabis was a readily available tincture that pharmacies carried, that doctors prescribed. It was not really until the marijuana tax in the 1920s and 30s and a bunch of fear mongering around that they really kind of clamped down on it. They used it as a scapegoat, and
even the government's research, back in the when Nixon had the war on drugs and all those things, they actually
Yeah.
they said that the report came back and they're like, actually, there's really no, like, the downsides of this are not, the upside way outweighs the downside, and they said, no, don't worry about it. We're still going to make it illegal.
Yeah,
So
they're
there's
like, ignore that fact.
ignore that fact, right? But of course we make highly lethal fentanyl and opioids just as easy as a pen stroke. I can write 200 micrograms of fentanyl patches for people, but that's neither here nor there, and we can get into that at some point. But yeah, I think you and I have come together on this project just to really provide like almost a safe space, to other providers. Say, hey, it's okay to start learning about this. And my big thing is, like, when I talk to my friends that are doctors or PAs or NPs, is like, you don't have to agree with cannabis, you don't have to agree with CBD, but at least be knowledgeable, right? Like, you may not
Exactly.
be a pain, you're not a pain PA. I've been a pain PA for like 5 years, right? You don't write opioids on a daily basis. Doesn't mean you don't believe in them, right? It just doesn't mean you just don't use them. So it's the same thing as CBD. You may not, recommend it, but as long as you have an understanding, hey, there's some medicine interactions with this medication, and you should be worried about this,
Yeah,
this, right? Just be
exactly.
semi-knowledgeable, be able to have a little bit of a conversation, and for lack of nothing else, like, at least be able to point them in another direction. Like, hey, I don't know this, but Stephanie and Charlie, go see their podcast. They're going to be able to help you out, right?
Exactly.
So
I feel the same way. And I tell my colleagues the same. I'm like, it's okay if you don't agree. The thing is that it is legal in almost all the states at this point,
right,
almost. And so patients are using it, whether you agree with it or not. And so
right,
we are first line. Like, they come to us to ask. So
right,
how fair is it for them for us to say, I don't know? I mean, I don't think that that's fair at all. Like, if we're able to look up information on any other drugs or medications that they use on Epocrates, on Up to Date, we should also be able to look up information and give them resources in regards to cannabis and CBD.
right,
And so that's my main issue. Like, as a provider, you should know what conditions cannabis and CBD are used for. What are the contraindications? What conditions it shouldn't be used, because
right,
it's not for everybody. And just the basics. And like you said, know where to refer them. It's
right,
just how, when I get a patient that needs to go see a cardiologist or a dermatologist, I'll give them the basics and then I'll give them the referral to the
right,
specialist. So
right.
same thing.
And then I think the problem, it leaves almost a vacuum for non-medical professionals that now have filled like the bud tender roles, that now are trying to educate patients. 80, your 82-year-old grandma is going to go to see the dispensary to get cannabis, and she's going to say, I have, arthritis, and I'm on these meds. Which strain would you recommend? They're like, I don't know. Well, I'll start with this one, right? So now we've kind of handed off our duty to, do no harm and to protect our patients to these people that are just uneducated, just by the fact that that's just not their job. They didn't go through the training that we did. And so I think it's important that we need to kind of take back some of this control in the medical field to really give our patients the best chance for outcome and care that we can, if they want to seek cannabis, right? I would never tell anybody everybody should be smoking cannabis, everybody should be using CBD. That's not the case. The case is it's a case-by-case basis. And, I think you and I have the same approach when we talk to our patients about it.
Yeah, and most importantly, if they do, to reassure them and let them know that it's okay, right?
Right.
Not make them feel some type of way because they want to use an alternative therapy.
I had a guy today come in for a headache, and I was talking with him, treating him, and he goes, hey, I just want to let you know that please don't tell anybody, but I did take an edible and it does help my headache. And I'm like, it's okay. I get it. I own a CBD company. I'm big into cannabis. He goes, oh, thank God. Okay. Most providers don't understand it. And it's like this little secret, like, that everyone talks about, you're like, it's okay. It's not like a secret anymore. People are using it and getting great benefits from it. It doesn't help everybody. But I think it's a good piece to the pie. That's what I tell my patients is it's a good piece. As long as you're doing what else you have to do, you're doing the exercise, you're eating correctly, you're sleeping correctly, all these things that helps. It's a piece of that treatment pie. And so, I'm just really excited to start this whole process together and really grow this universe and bring on, other medical professionals and researchers and pick their brain and everybody that's pro cannabis and people that are anti cannabis. I think it's important for us to hear both sides. And so, if you're stuck in an echo chamber, all you do is reinforce your own thoughts. It's really important to interview people that may disagree with you so we can find, hey, maybe they are challenging me on this idea and I should really kind of research this a little bit more. So I think it's going to be a really fun project.
Yeah, that's true. And you mentioned something about cannabis not being for everybody, which is true. I do agree with that. But
Yeah.
also, in part, is them not having the proper guidance, right? Because
True.
there's so many different cannabinoids. It's not
Right.
just CBD and THC. There's THCA, CBN. There's so many different other
Right.
options that they could be using, but if they're dealing with a provider that is not well versed or that is not knowledgeable
Right.
in the subject, then they're gonna say, "Yeah, these drops didn't work. Move on to the next, or let me just prescribe you 2 more pills and you'll be fine."
Right. Or a lot of my patients that went the other way, they went and they got an edible and they took, the typical, they take 1 bite, don't feel anything, take another bite, don't feel anything, eat half the thing, and then they're on Mars because they're so high, and it's scary,
Yeah.
and they don't know what to do, and it can last a few hours. They're like, well, I'm never doing that again. That didn't help. But with proper
Right.
guidance of like, here's how we're going to slowly titrate you, right? And here's how we're going to use CBD and THC strains and terpenes and kind of part of this whole plant and put it together. And, we've gotten accustomed to pills, right? Bayer, aspirin, really. Bayer came in, and as soon as the aspirin was invented, that really kind of did kill the cannabis field because it was an art to dosing. And now we're really used to writing, take 15 milligrams of this and, call me tomorrow. Cannabis is work, right? You have to take a journal with you when you're taking it and you're titrating it up and figuring out what's working and what doesn't work. And so it's a beautiful field. And I think I'm just really happy to be part of it and to really help further everything together. And we're going to
Me too.
Yeah.
Me too. I'm really looking forward to being part of this new movement. I don't even know if I should call it that, but
Right.
it pretty much is. It's being able to provide another option for
Exactly.
the patient and hope and possibly even like healing.
100%.
So
Yeah. Right. And
yeah,
I had patients working in pain management come in and talk to me about CBD and cannabis products, and they would hand in their opioids, and I'm like, what do you mean you don't want your Percocet anymore? Like, no, I'm just taking the CBD tincture, it's helping. I'm like, what's CBD? What are you talking about, right? And so it's sometimes for people can really help and change their life, and some people they don't get much benefit from it, and because I think a lot of times when they take it, especially for me, it's very subtle, and then you do, especially CBD tinctures, right? You take it subtle, and then all of a sudden you don't take it for a few days. You're like, oh, that's what it was helping me with, right? It's not such a punch in the face as like a THC strain where you're going to feel it, right? And so I think it's more subtle than most patients and most people are used to. When they take an aspirin, you feel it, it helps with your pain, right? And so just working on a different type of level. But yeah, anything else you want everyone to know?
No, that's pretty much it. Just that we are here. We're here for all the PAs. We're here for the patients. We're here for the community. Please reach out to us.
Yep.
I would love to collaborate, work together, and grow in this cannabis space together.
Yeah. So our email is info@medcannatoday.com. The website's medcannatoday.com. All the social media platforms. And so if you want to help contribute, please, we welcome any help that we can, help with articles and help with podcasts. And so, we're here to further the field from everybody else that's got more experience than us. So, without adding more minutes to the podcast, thank you for everyone for listening to our first episode. And we're going to try and release one at least once a week. And if anyone has any recommendations, please don't hesitate to reach out and let us know. All right.
Thank you.
Thank you, guys. Bye-bye.